So dual energy CT acquisition changed our clinical routine markedly. We used all initial experience and we tested this modality, and with one single dual energy CT scan we are capable to assess and grade the coronary stenosis, and accordingly we also have a visual of the corresponding coronary territory, whether it's hypoperfused, normal perfused, myocardium. This is very beneficial for the patient, it's time saving, and in our institution it's excellent for the cardiological treatment and cardiological management of the patient. To put dual energy CT at present to the right perspective, we have to emphasize that this tool is mainly a research tool. Although in our institution it's beneficial that we optimize it in certain level and we report it and we put it to the clinical routine, but we also have to evaluate this patient pathology, ischemic myocardium, with other modalities that are the so-called clinical standards. It's also very important that this is an additional to our clinical workflow, which is extremely beneficial for the patient, and the potential is enormous, since there is no standard modality so far that combines the coronary artery information regarding stenosis grading and the myocardial blood pool or the myocardium information. So we are capable, we seems to be capable of merging these two information and assessing the perfusion of the myocardium in a still image. So it's not a real perfusion, it's mainly a myocardial blood pool assessment, but furthermore it can be extremely useful for the cardiologist's perspective and further patient management. The greatest benefit is definitely for the patient side, because it's less energy consuming. The patient, the scan is 10 seconds at the best. We don't need any, we have further evaluation, of course, because we try to follow the clinical guidelines as well, but this is the least tiresome of the patient itself. It's very easily performed by the technologists as well. And we are standardizing a protocol how to evaluate a virtual non-contrast tool in our Siemens workstations that we are using in our daily routine to assess dual energy CT scans, and all the separate reconstruction can be evaluated in the workstation and can be reported very easily and smoothly. Right now, at present, we are using mainly the dual energy CT for managing to visualize the hypoperfused myocardium. We used one single image shot, so this is a myocardial blood pool assessment, whether there's a myocardial blood pool defect in the corresponding coronary territory or not. But it's extremely useful for this because one single radiation exposure generated by dual energy CT with using different kilovoltage, different energy levels, can reveal not just the stenosis of the coronary artery but the corresponding hypoperfusion. So we don't need to expose any further radiation to the patient. It's fast and it's very efficient for all of us. There are several studies that showed the stenosis grading itself is not sufficient information regarding the myocardial perfusion. There are 50% stenosis can cause significant deterioration in the myocardial blood flow in certain part or the affected area of the myocardium, while sometimes below 60% shows completely normal perfused myocardium. With the help of a tool like the dual energy CT acquisition, we are capable of assessing the myocardial blood pool beside the stenosis and can give a better idea to the clinicians which patient needs to be revascularized in an immediate fashion and which can benefit a later revascularization.